um, about 4 years ago, well, actually 5 years ago, I was about 48, lost about 40 pounds, and decided I was going to get some breast implants. And I got breast implants, and 3 months after, I got really sick. Now, during this time, I had started studying functional medicine. I'm a physician assistant by schooling since 1999, and started to think about functional medicine because I saw the wonderful things it did for autoimmunity, and I started to get sick at the same time. But I wasn't fully practicing functional medicine, and I ran into Garrick's athlete program because I was really fit and wanting to stay fit, but I kept hitting a brick wall, and nobody knew what was going on. But he was able to help me with the basic functional medicine principles to get well enough to then finally figure out that why I was sick was the breast implants. I mean, you just look at the timeline and it was pretty straightforward. But growing up in Western allopathic medicine, I thought, no way, that can't be it. The FDA approved them. They've got to be fine and all that kind of good stuff. But Garrick really took me through some steps, helped me learn functional medicine, and also was able to help me stay inquisitive and just learn the whole process, and then get my strength back to be able to explant, and then eventually open my own practice, and then do what I'm doing as an advocate for breast implant illness. Um, I do work full time as a researcher in class 3 medical devices, but it's in cardiology. So that's what I've been doing for the past 25 years. I honestly have no interest, though I do see patients in BII, but this is not what I want to do for a living. What I want to do for a living is to make sure that there are practitioners out there that these women can go to, because there are probably, I'd say, a minimum 500,000 women and men now affected by implant-related illnesses. And what I'm hoping is that this presentation, in the very least, you will put in your questionnaire for everyone: do you have an implantable device? Do you have an IUD? Do you have a pacemaker? Do you have a mesh? Do you have any of anything? Especially when you get through that timeline and you're going around the matrix and going around the matrix and you're getting nowhere, and that dysbiosis won't go away. We ask them if they have mercury fillings, we ask them these other things, but it could actually be the implantable devices that they have in their body. And so that's a little bit about me. I don't see Garrick back on, but we'll just continue if that's okay. And please ask any questions. There's going to be a summit in October where we'll have 35 presenters, from Ben Lynch to Karazian to Kiernan Krishnan to other functional medicine providers, to some plastic surgeons, to microbiologists and pathologists and thermographers, just so we can have a beginning conversation about what this is and what this isn't. Because everyone thinks when you explant these devices, we're fine, we're cured. That was not my scenario. And I would say that the lucky ones maybe are about 50% of those who explant get better right away. But then there's things that are lingering, and we need to tidy up the hormones and the biochemistry, and the dysbiosis is the hardest thing for me to deal with, I think, with anybody, let alone someone with an implantable device. But it seems like that inflammation is just different than I know it to be, and I don't know it all. And that's why the summit will be here, is to teach us about this so we can help these people. So let me see if I can figure out how to page down. And of course, there we go. So I'm sure you guys have all heard the phrase, we are what we eat, drink, breathe, and touch, and can eliminate. But it's also what we implant in our bodies. And more than, I'd say, it's actually up to about 450,000 augmentations are performed in the US a year. Keep in mind, and I might digress from these slides, but who gets breast implants, right? For me, it was all cosmetic and, menopausal, wanting to look better. But there are women who have cancer, who have mastectomies, who, didn't necessarily ask to have this situation, right? And then they get the breast implants. And in the Western Medicine Society, we actually prepare them to have the breast implant at mastectomy. So you're just trying to survive the breast cancer, and then boom, you're getting augmentation right after, and things called expanders. What's important about that part of the conversation is until recently, the expanders were all textured implants, and the texture would fall off in the body and then fall off in the breast tissue and then manifest in the lymph tissue and then go around the rest of the body. And that textured cancer is called BIA ALCL. So it's a lymphoma, and it's quite impressive, the disease state. The only cure for that is explant. And then hopefully with explant, you can have some chemo and radiation, and then you ideally get better. But we have had quite a few deaths. So even though we take it out, sometimes the chemical structures stay behind, like silicone, platinum, and the texture on the outside of the shell. So on the right side of the screen, if you take a look at all the symptoms, I mean, they sound like the functional medicine patient, the autoimmune patient. There's nothing in their symptoms that say, oh, you have breast implant illness. And basically, breast implant illness is a diagnosis of exclusion. There's not a single test. There's actually a hair test coming out that if you put this hair test together and it's high with platinum and you have clinical symptoms, you can say, oh, most likely it's breast implant illness and maybe you should explant. But there's really no way to diagnose this. It's let's explant and see how you do. And then the thing about explant is you need to remove the scar tissue that forms around the implant, and that's called capsule. That capsule is what I call the catcher's mitt of everything that comes out of that implant. Now you will hear people say, oh, there's metals in the implant, there's arsenic in the implant, there's all these things in the implant, and that's true, but they're in small amounts. But any of these amounts, the silicone and the platinum alone, if you look up their adversities in the body, it looks like an autoimmune disease. It looks like dysbiosis. It looks like leaky gut. And I think what then that does, as it affects your immune system, your gut, your minerals, you become imbalanced, and then your methylation shuts down. And then what a cascade to get ready to express genetically your HLA or your MTHFR or your COMT or things like that. So when I talk about the breast implants, I know that they have chemicals in them, and I know that they, all these chemicals, like, I mean, if we know BPA and we know glyphosate, think about what acetone can do, hexanone, stearic acid, there's even printing ink in there, and formaldehyde. What that can do to the body is just amazing. And so your catcher's mitt, your capsule, is what's taking all they call it a bleed. It's basically, whether it's silicone or saline, it doesn't matter. It bleeds out through the shell into the capsule, the catcher's mitt. So when you go for explant, you have to make sure that they remove the implant as well as the catcher's mitt, which is the capsule. Now, what's interesting is if you think about silicone, it's bounded to aluminum to make a gel, to make the shell. I'm not even talking about the saline that's inside or the silicone that's inside yet. It's just the shell. But that is lipophilic. So it is going to be drawn to a lipo-filled area, which is breast tissue. Some people use these implants in their butt as well, right? So the silicone and platinum are going to be like, where's my fat? I need to go for my fat. Let's go for the fat. Let's go. It's like a metal to a magnet. It's just going to pull through that shell into that tissue. And what's right there in the breast area is all lymphatics, right? So here's an example of having a breast implant under the muscle on the left and above the muscle on the right. But you can, I mean, look how close to that chest wall that there is. So there's risk in explanting. Even on the one on the right, which is above the muscle, there's risk. If that capsule grows too thick or too tight or even too thin, it's hard to scrape it off the rib. And right behind, oh, you can't, I don't know if you can see my cursor, but this is intercostal muscle. Right behind that is lung tissue. Right behind that is the cardiac, is the heart. So this is not a minor surgery, but so there's a lot of education that hopefully will be beginning there for plastic surgeons and as well. But all this tissue is fat and lymph, and in the way nature intended it, it does its thing. But that's where you'll find a lot of silicone and platinum, or at least I shouldn't say it so emphatically. That's where they found it in me, and that is what we're studying. And then what do you do about that if your client is then still sick after explant? There's a lot of potential triggers or mediators in that tissue. Any questions so far? Bet you didn't know you were talking about this today. Okay, so we mentioned lymphatics. I apologize for the pictures, the quality of them here. But what I want to call your attention to, this is actually my picture, so I gave myself permission. These are the implants, the cold spots. They're very cold. I don't have the full graph for you. But what I really wanted to show you is the hot spots of lymphatic congestion. And for me, when lymphatics congested, that means the autonomic nervous system it could be also at play, and the patient may or may not be in fight, flight, or freeze. And if you're in fight, flight, or freeze, you can't digest too well. You can't heal too well. And I think this is my thermogram actually when I actually met Garrick. But also look at this. I'm so congested here that I can't drain my head. I can't drain lymphatics. And one of the bigger complaints I hear is anxiety and brain fog from women who have breast implant illness. And this is all congestion. And if you go back to the picture, this is putting pressure, especially on the left side. About 70% or more of your lymph fall through the thorax. I'm using different landmarks, but go through the left shoulder into the heart, or into the vascular system. That's where you dump the most. Then you have a couple of key wheelhouses where the lymphatics dump as well. I'm blasting through it, but it's, you know, the FDA just recognized breast implant illness as a real diagnosis, and we're working on ICD-10 codes as we speak. So hopefully in 2021, we'll actually get a coding for ICD-10. Over the last 2 years, the FDA has recognized this, and we've actually been fighting for the last 60 years. I'm not that old, but other women before me. Somehow they were able to have the manufacturer say it was just leak. And the FDA told them to go back and study it and do post-market studies. And every single company did not follow through on their post-market study. And about 3 months ago, the FDA gave them all a warning, which is basically a slap on the wrist. So I'm not necessarily fighting the manufacturer. I want to get these people well. What I went through and what the other 250,000 women are going through right now is, who can we trust? So I send my folks, because I coach them, I see them all over the world, to functional medicine providers. But what I'm finding is there's a wide range of us, and I want to make sure that at least the functional medicine community can be there for them, and we start to get good education around it, hence the summit. You know, we talked a little bit about all the chemical stuff. People will be, you know, is it just silicone? I don't have a leak, I don't have a rupture. It's not just that. It's all the adjuvants. It's all the, you know, if I did the ELISA LRA Act by biotechnologies, I think that's Dr. Jaffe, most of my people don't come back with a silicone sensitivity. They come back with a styrene sensitivity or other things that can derail your immune system. And it's quite impressive. There's quite a bit of literature. If you go to the website, breastimplانthealthsummit.com, there's a resource page that is all, the majority are published articles and peer-reviewed articles. There are some videos on there, but I'm summarizing, but there's some really great researchers like Dr. Dietschkom from the Netherlands, Dr. Capel, Dr. Nicolaitis from Canada, he's a plastic surgeon, and where Dr. Karazian in autoimmunity is starting to look at this, and Ben Lynch is taking a look at this from a genetics perspective. And some of the reasons why we picked those speakers, actually a lot of them volunteered, everyone volunteered, but a lot of them, called and asked if they could, is to help spread the awareness of this and to really make a big impact in 2020, since we're all sitting at home with COVID anyway. So it's not just silicone. We don't know specifically. UCLA is studying the different genetic factors that might be underlying. But again, the plastic surgery community is taking a look at it, and they're looking at it as, let's find the problem. The problem is what the body does with the implant and with the materials in the implant. And then each person is different in how they express genetically. But they haven't ever proved that the breast implants are safe. There was one dog named Esmeralda that they studied for 2 weeks, and they thought she did fine. So they decided to manufacture these when these were class 2 medical devices. And then they got grandfathered from there. It's quite an amazing story. It's hard to see, but some of the testing I do, and the summit will go over this with my mentors who taught me how to do some of this stuff. But I really love the organic acid test, and I tend to like Great Plains over Genova just because they have a couple of different markers that affect the BII population, and oxalates is one of them for me. And now that I've been doing this for about 2 years, I also now know why the oxalates and the B6 and the yeast and different things. So my testing is more along the lines of history and get them out, and then let's see what our baseline is. So I love the Dutch test, and I also look at stool. And what I found interesting over time is, and I haven't learned this from IFM too much, but I like seeing the heavy metals via hair and minerals, because I like to look at what they've been doing. And it gives me an idea of the state of, some people call it cell danger response, but it gives me a glimpse of the autonomic nervous system. It can tell a big story. I don't use it to like go after certain metals. I nutrient enrich the body to have the body do what it needs to do. And sometimes it needs a little nudge, like a chelator and things like that. But these women don't have much residual in the adrenals that I don't tend to push that, but I get to use the mineral and the way you can, like, they call them bowl patterns and things. But I'm finding that I would love you guys' thoughts on hair and mineral tests, because I like it as a glimpse into the whole person. And so those are the 3 main things that I do. And then of course we'll do some regular Western medicine labs just to make sure their D's good and stuff like that. But it looks like the basic things we would do functional medicine wise. And I think the way we tease it out and adding that surgery in there is a big deal. And that's, I think finding their vulnerable issues are, that's where knowing your patient and the history is going to really come into play, because they'll have what they call, some people call them healing crises and some people call them flares, but it's never a straight line in the clients I see. Once you explant, you're fine for 3 months and then you crash. And then you get past that and then you're fine for 2 months and then you crash, but it's not as hard. There's different patterns, but there's distinct patterns. There's actually different patterns in the brand and the type of implant you have. The gel, people get sicker, the gummy bears. The saline, they have a lot more, I think, moisture and have a lot more fungal interactions. And some of this stuff you'll be able to check out at the summit. what I find really supports them is body work, visceral work, acupuncture, um, and nutrient enriching these people, which is not easy. And most of them, everyone wants to push folate and B12, but I think B1 is your friend, and B6. Uh, I like B6 and B3 together. Um, that's my magic formula. But so here's some pictures. So talk about lymph. These are my ankles, and this is a good day on the top when I had breast implants. And I was a tiny little thing then, but my legs weren't. And then below, it's hard to see, but there's so much acne. These aren't the best pictures. I didn't think I was going to be giving a presentation to anybody. But what I want you to look at is look at my eyes on the bottom right. I was happy. That looks like a good day. But notice, I'm going to show you some more pictures, but notice the eyes. So this is before explant. I don't have an after explant until the end of me. But here, now granted, she has makeup on the right, but just look at the eyes. There's something that happens post explant. I think that was 4 months after explant for Terry. She's one of the hosts for the summit. And these are what the capsules look like via M-Block. Sorry, I should have prepared you for some gross pictures. It's lunch, it's all good. So, we don't have to get into N-Block versus capsulectomy, but if you take a look at the middle picture, that's a very thin capsule. And they'll call that grade 1 Baker. It's a score of a Baker scale grade 1. A thick capsular contraction is grade 4. And funny, insurance will take out the grade 4 capsular contraction, but they don't say anything about this. This is a thin catcher's mitt. These are the women I worry about the most because the toxins can get through this shell. The grade 4 did its job, man. It caught it. And there's always going to be a margin of error there, but there's a variable. But these women, I get worried about because if they have gummy bears, most of their stuff is going out into the breast tissue, which then is the lymph. And the lymph goes to, it carries all your fats, it carries your hormones, and it's your detox system. So if that gets congested, I think that's chronic disease right there. And on the right, that's a capsulectomy where they couldn't take it all out. Like the middle picture, bottom right, that's N-Block. They took the whole scar tissue out in one fell swoop. Sometimes you just have to pick it off. And this is a leak. You can see where the gel leaked out of the implant. And that was in the patient leaking, not during the surgery. And this is another one. These are, I think, 15-year-old, and the body did so good, it dissolved the outer shell of the implant. And that is silicone. And that silicone, I haven't found a way for it to leave the body. They've done some literature on, one lady left her body to science, and they found the silicone particles, which is bound with platinum, mind you, there wasn't an area that didn't have silicone in it. And that's thanks to the lymph. People will say, sauna, exercise, do not advise your patients with breast implants to sauna because the shell will break down. It was never temperature tested. But that's what I did because I was told this is a good way to cleanse and stuff. But yeah, I just got triggered there. It just makes me so frustrated that there wasn't enough testing to know that this was a potential that could happen. And I don't just play one on TV, but I'm a trained medical professional that works in class 3 medical devices. I thought they did their due diligence like we do with pacemakers and stuff. And not that, there's always going to be something with an implantable device. It's a man-made material in a human body. So, but they could at least prove safety and have a fully informed consent. Now there are studies, and we'll go over this in the summit, which is a 3-day summit, which you'll actually get the recordings for I think at least 3 months or a minimum of 3 months because it's a lot of jam-packed material, but and I think it's too much to sit through for 3 days, but and I totally lost track of what I was going to say, but it will go over all of the things that can go wrong, and then we will begin the conversation of what we do to heal this. You know, people will say use inositol and sauna, and we do get better even when the silicone's in our body. So it's not all doom and gloom. And there are some people that are walking around with lymphoma and different types of cancer, like melanoma due to the breast implants, and multiple myeloma due to breast implants. And we lose them, right? Because we don't know how to funnel them, and we don't know what the root cause is. Well, we do know, but they need to find the right people. So here's some more pictures. This one here is my favorite. She was my roommate at the FDA conference, and look at her eyes. She presented with eosinophilic esophagitis, and no one believed it was her breast implants. This is 1 month later. Like, I can't make this up, but it looks like, well, the lighting's different, or this is different. Like, you just can't, I just can't express what I see in these women. And it's so, I mean, most women are scared about being disfigured after. There's ways to be cosmetically whole again without implants. And here's another one. I think this is, again, 3 to 4 weeks post-explant. And again, like the eyes, like, don't look at the makeup, but there's something to be said of, like, if the eyes are the picture to the soul, like, it really does feel like you're dying. And, you know, I don't enjoy taking care of the patients with BII, because they're the ones that are going to drive you nuts. And you're going to think they're batshit crazy. I mean, I was batshit crazy. I tell my clients, I don't tell them that they're batshit crazy, but because you just don't know who to trust, what to do. You've been through probably, 100 different doctors, and you know something's wrong, but you can't prove it. And then some of us, no one, even the plastic surgeons won't explant you. You have to find a certain one, and blah, blah, blah. So we've been through the ringer. And it really is a question to ask them, do you have breast implants? And some people, if you say, do you have surgery? They don't know that the breast implants were a surgery. Don't know exactly why. Some people, you say, do you have an implantable device? They don't know that that means an IUD. Each of these, even a pacemaker lead is made of silicone. And, if that person then has a run of bronchitis and has all the antibiotics and things, and they don't get well, I mean, it could be the implantable device, but you're not going to remove the pacemaker lead. You're going to optimize their health. And how do we do that? That's the question. That's the goal. That's what the summit hopefully will yield a consensus statement. And that's me. You can't see the eyes, but that was right after, and I felt probably 70 to 80% better immediately. And if it didn't happen to me, I wouldn't have believed it. I would have thought it was all like the anti-vaccine people, which I don't believe in. So any questions? I think you guys are on mute if you have questions. Yeah.
Can you talk about, this is excellent. Danielle, thank you for sharing so much. This has been excellent.
You're welcome.
I have a personal story with my sister, and I'll hold on to that, but I do want to hear about what you think about IUDs and the connection. Are they made of silicone? I actually don't know.
Well, and again, remember, there's a lot of stuff in the breast implants. And what I find the sensitivity to, and my N is not huge. I see patients part-time, but it's styrene, it's the plastics that people don't respond to. And I think that the IUD absolutely can trigger autoimmune cascades. So there is a statement on all the manufacturers' sites now that if you have autoimmune disease, you might want to know that breast implants can cause an exacerbation. If you have asthma, or if you have a family history of autoimmune, you shouldn't get an implantable device like breast implants. So I do think, and I have seen IUDs be the culprit. Now, the ones that I have the most trouble with IUD wise are the ones with copper. And so it can throw not only are they maybe being sensitive to the IUD, but it could be the copper zinc ratio as well. So it depends on what they have. But even the newer Mirena ones, I just, when in doubt, take it out if you can. I mean, if it's a pacemaker, a mesh, oh, meshes, oh, good Lord, let's not even talk about that. And for some, it can be really devastating. But think about it too. What we don't know is if you can turn on gene expression, you can turn it off. And I know for myself, the amount of B1 and B6 that I had to take to feel whole, like I actually feel the difference for myself. And this doesn't mean this is what you give everybody, but was amazing. So what I just didn't have enough intake to keep up with the body demands. So maybe that's a conversation for those who want to keep their breast implants or want to keep their IUD or their mesh that you really can't take up without maybe surgery isn't better. All these women who have BII are going to present so sick, but there's nothing wrong with them. And I waited about a year to get better before I had another elective surgery, but I just kept getting worse. And so, and then I explanted and that evening, now granted, no, that evening I had great sedation medicines from anesthesia. So I thought maybe that was it, but it stayed with me for quite a while. I did end up having flares and different things, but they slowly dissipated. So yeah, IUDs can do it. I mean, if a dental cap can do it, right? If a crown can do it, we're all up in if you haven't gotten there yet in your functional medicine training, it'll be there, and we get all up in the dental stuff. That's smaller, and that's right at your mouth, and your mouth is right at your digestive tract. And the amount of lymphatics you have around your gut, if your lymph is full and can't protect you, or full of biofilm and gunk, right? It's the same, it's a similar concept. It's just putting the story together. And I'll be glad if you guys see, to get my number from Garrick. If you start seeing these people, I will be glad to work with you with these people, get you up and running. This isn't, I'm not looking at this as a money maker kind of thing. And we need good people to take care of. And there's not that, so it's a good niche practice, which I don't want to do anymore. In a good way, Any other questions? And yes, I'm in the back of a car.
Hi, Danielle, this is Keegan. I did have a question. The picture that you showed earlier with your ankles being really swollen and the acne, that was before you had the implants removed?
No, that was I was fully sick with BII with implants, and I didn't know what the cause was.
Gotcha. Wow.
Yeah.
Okay.
Now, but that said, growing up, so I had Graves' disease as a kid, and I mean, I still have it. And I had swollen ankles then, but I hadn't had swollen ankles in forever. And now I'm fit. Like I had a 6-pack at 48. I was like so psyched. Got some breast implants. I drank the Kool-Aid, and then within 3 months, this started. I couldn't work out anymore. I was exhausted. I tore meniscus. My ankles would swell. The acne, my arms would swell. Itching. Oh, the itching was crazy. And they told me it was just menopause or perimenopause. And that's wrong. Now I'm going to follow you guys. And if I hear anyone of you saying it's just menopause, I'm going to smack you. But no, menopause does not have to be bad. I'm 50, almost 4. I'm 53 now. And like I am full, like, I do bioidentical hormone replacement, but I am nowhere. I am great, especially compared to that day, which that's what you told me the rest of my life was going to be in menopause, and I was actually estrogen dominant. That's another thing that we'll see because of the xenoestrogens. is the estrogen dominance, and that progesterone is a lifesaver and helps you rest and detox at night. I mean, there's all these little tidbits, and I would prefer you guys hear that at the summit. It's a real, if you go to the summit page, that'd be great. It's $150 for, like, I think it's going to be over 12 hours a day, but there's not one presentation that won't be awesome. And no, you don't have to watch it all for the 3 days. It was supposed to be 10 people in a room for 5 hours discussing what we were going to do next. Then COVID hit, and so it's Garrett's fault. Go for the stars, he says.
Danielle, this is absolutely fascinating. Thank you so much for doing this for us. I have a patient that I have been working on for 10 years, mostly as a physical therapist, because she just keeps coming back and she's got all the symptoms, and we've tried to work on her. I've tried to convince her, like, you got to work on your gut, you got to work, and she keeps blowing me off. So I would love to send her to someone who might be able to convince her. But my question, when I think about these women and women I've had in the past with breast implants, and especially the mastectomy, is there anything in the summit basically to work on this is the word, but not just the aesthetics of it? Because there are a lot of women out there who, once they've had a mastectomy, are not okay not having implants. Is there any kind of information out there of how we can help counsel some of these women to say, you know, I mean, or any kind of psych in there that helps with these women?
Well, we actually will have a psychologist there. There is a physical therapist who unfortunately just said she couldn't speak at this summit, but we're going to do another FaceTime with her. That's a big deal. And what my first goal is to, when you go for the mastectomy, you just found out you had cancer. You're now going to go get a biopsy, then you're going to have surgery, then you're going to have chemo maybe, then you're going to have radiation maybe. So let's go ahead and prepare you for, like, we in Western society, we don't give you time to think about it or even make it an informed consent. And is that the right time for you to have the informed consent, right? So the doctors think, okay, well, I think you're going to want implants, so they're going to put in these expanders. So, and we already talked about, up until like the last 2 years, they were textured expanders. And so all those women are at risk for a second and a third cancer. Now, I'm okay with women making a powerful choice, implants or no implants, nose job, no nose job, but let's have it be fully informed. And then those women who are sick with BII or BIAALCL now and are breast cancer survivors, I mean, this should be a summit all on its own, because the conversation is, I mean, I just get really real with them, and we don't know if it's BII. And we're working on trying to develop testing to give us more guidance that it is this. But if you've had autoimmune, right, and you have a high family history for it, or genetically maybe you have HLA or MTHFR or COMT or whatever, like here's a possible path. And then you can say, you can always beef them up as best as you can. And if they're okay with that % vitality, they're okay. But I hope it's an empowered % of vitality. And know that there's a possibility for more. Like I couldn't, the brain fog was just nuts. I mean, I couldn't do my job, and it's not the life I would want to live. We have a very high suicide rate with the women who have breast implants. And some of it is because they have to deal with, if I lose my breasts, I'm not a woman. If I have to take them out, that means I killed myself. I made a bad choice, and now I've got to, go through more healing. And now, like, there's so much psychological stuff in there. And at the end of the day, every woman who has breast implants, it's out of and I cautiously say this because I'm speaking more from my own experience, it's out of a place of either I want more, I'm not good enough, I don't fit the cultural image of a woman. Like, so the conversation is so much bigger than just X, right? In my case, I drank the Kool-Aid. I don't know what it's like to have breast cancer and then be just take my breasts away. So I just, with all the compassion, it's not hard to have compassion, but with all I can, I just, and if you follow any of Gabor Mate's work, When the Body Says No, great book, great book. People who get cancer have I'm surmising, he doesn't use these terms, but we have a way we hold emotion. Everybody does. We have a postural strain. Your physical therapy, right? Like, you have a way you hold your body. In autoimmunity, some people call that hypervigilance, but like for me, I get the head tilted back thing, and you might be able to see it, but other physical therapists might not be able to see it, right? And then that makes a predisposition. And if you're holding your body this way, you know, are you able to breathe and use your diaphragm to move your lymphatics? Are you, like, so there's so much, and there's so much. I'm gonna, Danielle, nice name, by the way.
Yeah, I like yours too.
I want to send you an email to what's Susanna? She's in Asheville. She's a PT and she does breast stuff.
Awesome.
And I think you guys will hit it off. And she's got a lot of courses that will speak to this. And I'm working with her for breast implant explant stuff.
Can I just put my email on the chat and you'll get it? Or Sarah, what's the best way to do that?
Sarah, if you can send it. I'm not too savvy with this chat thing.
Absolutely, I can send it to you, Danielle.
Thank you.
Which one of us?
Well,
Danielle Valores. I will Danielle's.
and I think I see yours, Danielle, at Battleborn Healing.
Battleborn Health.
Yeah.
Thank you.
You're welcome. Yeah. So I would love to see you guys in the discussion. I would love to, Danielle, if you want me to talk with your client, with you, I'd be glad to do that.
That would be amazing.
Would prefer not to take anyone's clients. I can if you guys are just and they really need help, but that's not my agenda. I need to get through October, and I'd rather give you, I mean, I don't know much, but you can have it all, because there's, if they're going to be putting in, $500,000 a year, and I think 10 to 20% will know that they have breast implant illness. And there's probably more that just buy that it is menopause, it is whatever. And that's because they had cancer. And, and it's a little passionate.
Yeah, thank you very much. I will, because I just adore this woman. And then I've got another one in my caseload right now who's like she's 31 and she's super excited to get her implants. And I'm actually going to show.
Have her come to the summit first. I mean,
that was another question.
Yeah, everyone can come to it will be more of a practitioner to practitioner level conversation, but because we'll be talking about the published data, but we can, and I'd rather, if she's somewhat intelligent, I'd rather her get the information that way than some of the breast implant illness groups, which are amazing, are, women are just finding out, so they're freaking out and they don't know what to do, and it's just a little bit more emotional.
Yeah. No, I really appreciate that, because I was thinking about really sitting down with her and talking to her about this before she makes that decision.
Yeah, and it's a little weird sharing with a guy in the room, but they do things and fat transfer has its own issues. I mean, you're taking your immune system, ripping it out of your body and trying to get it settled in another part of your body. And that's easier and more stable. It's stem cell basically to do if you don't have the implants, because you have the inflammation and scar tissue that makes it harder when you have breast implant, explant. But it still works. I would show you mine, but I feel funny because I see the recording button. But you can look female and be female, and had I known, maybe this would have been a route to go. But really, at the end of the day, I would love us to just be whole and complete with who we are. And it's taken a long time to get here. And I also am still very just on this side of it, that it's not a conversation you can just have one time and then the person's fine and they don't want to improve their looks and stuff like that. So that's what I got, guys.
Danielle,
Amazing.
thank you so much for bringing up this incredibly important topic. And you're absolutely right. I mean, this is not mentioned at IFM, which, you know, trains a lot of physicians and other practitioners. I'm so glad you brought it up.
It's not mentioned yet. There, when I studied for the exam, I think there were at least 4 people that had implantable devices that were sick, and they got better, but they didn't get well. You know? And so I have to just find the right person to talk to, I think, because I can't wait to provide that. What do they do? Those little podcasts. Here you go. So.
Yeah. Oh, that would be fantastic. So, you know, when you become IFMCP, they really want you to do those sort of continuing education podcasts, webinars. Man, that would be fantastic. But the next time I work with any of the committees and stuff, I'm definitely going to bring this up, and it will definitely be one of the questions that I ask all of our patients. So
thank you.
Thank you.
Yeah, you guys just
Thank you.
ask the question, and you'll know. I think a lot of us, or I'd like to think a lot of us are intuitive, and I think from here out, now that you know that to set your Geiger counter, and it's not a death sentence. It is if we don't find it. These women end up committing suicide, and they can't get out of bed for, you know, a lot of them, the way how sick they get. So, you know, go get them. I'd like to see you at the summit. That's what I got.
All right. Thank you.
Thank you, guys. Bye.
Thank you, Danielle.
Oh,
Appreciate
Garrett,
you so
you're
much.
on. Hey.
Yeah, I've been listening the whole time. I've just been quiet.
Oh, good. Thank you, guys. Have a great day.